In the US, the specialty care, highly specialized care, is super. Where we have a real issue is in the GP area. We have a problem in the integrated care, the coordinated care for patients with chronic disease. What do I mean? This goes not only among caregivers, but also in the psychosocial field, if you want. If a patient comes in with a broken hip into the hospital and gets a hip replacement, and you don't ask, where do you live, in which floor, maybe no elevator, and maybe the wife is at home and sick, and he has been taking care of that wife for a long time, and then he is depressed and doesn't know, and nobody knows what's going on in the hospital. Very often these compounding factors play a big role in, depending if a social worker is included, or if you have appropriate help at home, home care, it makes a big difference in outcome. So one has to ask, what can we and how can we improve? So I think first of all is health education, very basic. In the schools, the children should learn about healthy lifestyles. And that means, exercising, it means eating healthy. It's the basics. And then I think we have a big gap in preventive care. We have a big gap in taking care of the obesity problem, which is an epidemic here, but not only here. If you look, for example, in urban centers in India, same. In China, it's coming too. And it's not only the adults, it's also children. And that has, of course, a terrible impact on health of the children and the future generation. We need much more transparency on diagnosis, intervention, and outcome. And I understand the privacy, issues, but frankly, there are ways to circumvent these issues. And unless we have really solid data, we cannot make really rational decisions. And so that is absolutely crucial.